سلام، خوش اومدید به یه قسمت دیگر برنامه هانا پلاس پلاس. چند ماه پیش من تصمیم گرفتم که تخمکامو فریز بکنم به خاطر اینکه فعلا قصد بچه دار شدن ندارم، ولی میخوام قابلیت باروریم رو حفظ بکنم. نمیدونم که چقدر راجع به این تاپیک اطلاعات دارید، ولی من سوالات خیلی زیادی از سوشال مدیام گرفتم راجع به این تاپیک، راجع به هزینه‌اش، راجع به پروسش، راجع به اینکه در چه سنی باید انجامش داد. امروز دوستم رو که در طول این پروسس باش آشنا شدم، دینا، دعوت کردم که بیاد اینجا و اطلاعات کافی رو بهمون بده. با من همراه باشه. من تو جریان فریز کردن اگهام با پرستارم دوست شدم و کمک خیلی زیادی به من تو این پروسه کرد. ازش دعوت کردم که تو این برنامه شرکت بکنه که اطلاعات بیشتری بتونه به ما بده. خوشحال میشم که باهاش آشنا بشین. Hi Diana, how are you?
I'm good. How are you?
I am good, thank you. Thank you for being here.
Thank you for having me.
Thank you so much. Can you introduce yourself and a little bit of your specialist?
Of course. So my name's Dina, Dina Saleh. I am a registered nurse, but I have a specialization in fertility, reproduction, and women's health. I have 2 certificates from the American Society of Reproductive Medicine, and I've been working in fertility since 2019. It definitely is my baby. It's my vast of expertise, and I really love what I do. I find that it's a very happy field in terms of the medical field to work in because you're bringing life into the world, and it's often very rewarding as well.
Nice. I did my process video,
Of course.
and I kind of have a lot of information because of you. I want to give this information to my friends. They want to know about it more because before I did that, I didn't know this topic is so important for women, and now I'm just getting so many feedback, so many questions. They're at the same situation like me, they're kind of in their 30s. They don't maybe have a partner yet. They don't know they want kids or not. They just want to be sure that they are able to have kids maybe in latest 30s or in their 40s. And I think this is a perfect decision if you can make it. And you tell me why it is important to do that.
Yeah. So first of all, what social egg freezing is, it's the extraction of eggs from the ovaries, and we preserve them for use at a later time. When we think about the importance of egg freezing, when we think back way back when to the 1800s, women were having kids when they were very young, typically 13 in their teenage years, between 13 and 15. When we think about the difference, aside from that, when we think about the difference between women and men are able to produce sperm their entire lives. Obviously, as they age, the quality of their sperm declines. However, women, it's a completely different aspect. As women, we're born with X number of eggs. We don't produce more eggs after we're born. And from the time of puberty, we use about 1,000 eggs each cycle. A common misconception is one of those eggs is what gets ovulated and the rest of them are reabsorbed for later use. That's not the case. The dominant follicle or the dominant egg is what gets ovulated or released from the ovary into the tube for potential fertilization, whereas the others degenerate and we can no longer use them. So as we get older, the number of eggs we have decline. And the best quality and highest quality eggs are typically used when we're at our youngest. And this comes back down to basic biology and natural selection in the time of Charles Darwin. So as we get older, the number of eggs decline and the quality of eggs tend to also decline. So when we reach our late 30s or our 40s, there's a higher rate of embryo aneuploidy, which means genetic abnormalities or abnormalities to the eggs or the embryo itself. So by preserving your eggs You're preserving the quality, and it doesn't matter if you're 40, 50, 60 at the time that you want to get pregnant. There's a higher chance of a live birth rate and a healthier child to be.
But is it possible, like when you're 60, like?
I've seen it in the late 50s and the 60s. No. So oftentimes before you come in, we do a bunch of tests, and these tests it's a hormone panel, and we do what we call the anti-Mullerian hormone. Anti-Mullerian hormone is a test that tells us that is able to predict the number of eggs you have within your ovaries, but it's not a predictor of natural fertility. In terms of pregnancy, it comes down to your uterine health. Obviously, as we get older, we tend to face more issues with our uterus, things like fibroids, cysts, polyps, even adenomyosis, things that aren't seen when we're youngest. So it's obviously better to attempt pregnancy at a younger age and not delay it to the late 50s, maybe even 60s. But I have seen women get pregnant in their late 50s.
Amazing. And I hear a lot this question. They ask, how much does it cost?
Yes, that is always the biggest question we get. So egg freezing can cost anywhere between $5,000 to $7,000. The clinic I work for, we do at present offer the lowest price in the market. Right now, for a RAMQ or a Quebec patient, it's about $4,500 to $5,000. That's the special we're offering at present.
And a yearly, how much is cost for the storage?
So the storage of the eggs, I believe the first year is always included in the initial cost of the egg freezing. But every year you pay about $500 just to freeze the eggs. But it varies from clinic to clinic, and it can go between $500 to $1,000.
I know this price is just for one cycle, right?
Yes.
And what makes people to do this cycle again?
Multiple cycles. So oftentimes the success of egg freezing is dependent on the number of eggs you have. So in a study done in 2019 in, I believe, Chicago or California, they had a census of women who were 35 and under and a census of women who were 35 and older. So in women who were 35 and younger who had 15 eggs frozen, there was a 70% chance of a live birth rate with at least one child. In women who are older, so in women who were 35 or older, that rate dropped for about 15 eggs to 39%. So it's always recommended that the older you are, the more eggs you freeze, but obviously the more eggs there are, the higher chance of multiple births or multiple pregnancies. In general, you need at least 10 eggs frozen to have one successful live birth.
Okay, then this depends of the, I don't know, the process that you put it with a sperm to be a...
Yes, so when you're ready to use those eggs for potential pregnancy, you contact the clinic and you let them know, I'd like to thaw my eggs and fertilize them. Whether it's donor sperm or partner sperm, they'll come into the clinic, they provide their sample, and there are different technologies we can use to ensure that there is the best sperm, but our skilled embryologists typically look at the sperm under the microscope, and they are able to select a sperm, and they'll directly inject the sperm into the egg.
Are you able to choose the gender too?
In Canada, unfortunately, it's illegal. If you do go to the States, you're able to select the gender of your child.
Technology is amazing.
It is, yes.
And I know yourself froze your egg when you were 25 years old.
Yes, I did.
And I was like, because I didn't even know about that when I was in that age. For sure, because this was your passionate and your career, you hear more about it. But I guess you have even more chance when you freeze your egg when you're in your 20s, right?
So I froze it a while ago when I started infertility. And the reason I wanted to do that is I actually wanted to understand the process of ovarian stimulation a little bit more. So what ovarian stimulation is, it's the process by which you're injecting the hormones in order for your ovaries to grow multiple eggs. So as you remember from your process, egg freezing is a multi-step process. It starts with your initial consultation with the physician, and then we do the baseline tests. Baseline tests are tests that give us an insight to your ovarian reserve, as I said. It's important to know that ovarian reserve doesn't predict natural fertility, but it does give us an estimate of the number of eggs in each ovaries and how much medication we need to give you and what your potential response to the medications we give will be. So they're very important tests for us to see. There are a couple of ultrasounds that we do. Number one is your baseline ultrasound, and it just gives us an overall insight to your reproductive health. So we're looking at the uterine cavity to make sure it's nice and healthy, that there are no structural abnormalities, things like polyps, fibroids, or cysts that can potentially disrupt the stimulation process. The other thing that we look for is your ovaries. How many eggs or follicles are there on each ovary at the beginning of each cycle? The other tests we do are just legal requirements here in Canada. We have to test for all the sexually transmitted diseases to make sure you're negative, and all the viruses we get vaccinated against as children to make sure that we're immune. This is a legal requirement, has to be done. In some cases, a doctor might order what we call a saline ultrasound, but this ultrasound really isn't important if you're just choosing to freeze your eggs. It oftentimes will let us see if your tubes are open, and this can actually impact implantation or natural fertility. So what the saline ultrasound is it's an ultrasound by which we inject some fluid into the uterus and we watch it move throughout the tubes. This allows us to see more clearly sometimes if there are any fibroids or endometriomas on the ovaries that can potentially impact your response to the medication. But the true purpose of this test is to make sure the tubes are nice and open. We don't really worry about the tubes being open until the time of an actual implantation or pregnancy. So once all your testing is done, you come back, we advise you of your test results, and you're able to start your cycle at the beginning of a period. The first step in the egg freezing is obviously the ovarian stimulation, which I'm sure you can talk more about. Ovarian stimulation is the process by which you're injecting yourself with exogenous hormones. So in a natural cycle, although we have multiple follicles that rise to the surface of the ovaries, one of those follicles grow to become the dominant follicle. That's the follicle that will continue to grow and eventually be ovulated for potential fertilization. Now in egg freezing, we disrupt this process by giving you exogenous hormones, which are a combination of your reproductive hormones. So FSH is your follicle stimulating hormone and LH is your luteinizing hormone. And these injections act on a system in our bodies called the hypothalamic pituitary gonadal axis. It's a mouthful. To tell the ovaries to grow these eggs. We hope that it'll be an even growth. There's no way to predict it, but they are the hormones that are responsible for the overall growth of multiple follicles on the ovaries. Now, obviously, this isn't natural. Our body isn't used to this. During this process, you might feel some bloating. A lot of times I hear that they're fatigued, and that's due to the amount of hormones. Bloating is normal because typically our ovaries are the size of an olive, and with all the medications we give you and all the follicles that are growing, I've seen it, grow to the size of a tennis ball or an orange sometimes. This is totally normal, so the bloating and feeling heavy is normal. Fatigue, sometimes nausea, headaches is a common side effect.
And
those
it's like a hormonal change, it gets mood swings. Yeah, like that part.
Yeah. I always tell my patients' partners, you have to put up with things. You have to have some extra patience with them for this 2 weeks. So stimulation typically can range a good stimulation can range anywhere between 10 to 14 days. But obviously we worry about the growth of those follicles. We want to stop your body from releasing them. So your ovaries become heavy and it's sending a message to your brain saying, hey, this isn't normal, it's time for me to ovulate. So at that time, we introduce what we call an antagonist, which is also an injection, and that is a medication that'll stop you from releasing those eggs. Once the antagonist is introduced, we try to warn our patients that you'll be at the clinic every 24 to 48 hours until the time of your trigger shot. So what is a trigger shot? The trigger shot is the final injection that you take in your cycle. Patients are often so happy, but they're so anxious at this point. The trigger shot allows for the finalization of the maturation of those eggs. It's a time-sensitive injection. It's given 35 to 36 hours before your procedure. And we give you the exact time to take it based on the time that you're scheduled for your procedure. Once that trigger shot is given, you're good to go. Like I said, 35 to 36 hours later, you're seen back in the clinic for the procedure. Procedure is day surgery. Obviously, it is a bit invasive. So what happens is typically you'll come in an hour before your appointment. A nurse will go over the procedure with you. Typically, the doctor will come see you and review some consents with you. Once all that's done and you understand the procedure, we insert an IV. Through this IV, you'll get some sedation medication. And before your procedure, we often give you Tylenol, Advil, and Gravol. Gravol is just to help with any nausea post-procedure, and Tylenol and Advil is just for pain management post-procedure as well. Once you're good to go to the OR, you head in, and your name and your date of birth is confirmed with the doctor and the embryologist, and they use an ultrasound, transvaginal ultrasound probe with a needle guide on the end, and they guide this ultrasound probe into each of the follicles on the ovaries, and they aspirate the fluid. Once all the fluid is within a tube, they pass this off to the embryologist as you're in the procedure, and the embryologist will continuously look for the number of eggs. Typically after the procedure, they'll let you know the number of eggs that are retrieved. Again, we don't expect you to remember it. So the next day, the embryologist will always send an email just to let you know how many eggs and how many mature eggs there were in a sample. And then they freeze them by a process of vitrification, which is a slow freezing process. And they're stored until you're ready to use them.
Amazing. I think you cover all the process very well. I don't have any questions anymore. But I want to know, like, I guess we can give your contacts.
Yes, of course. So I work for Original Fertility. We have 2 locations. There's one location in Ottawa for our Ontario patients, and there's a location in Montreal as well. You can contact me at dsaleh@original.com for an appointment, or you can always contact the clinic by phone, or my number is 438-468-9981, and I'll be happy to take care of anyone.
مرسی از شما که برنامه رو تماشا کردید. امیدوارم که اطلاعاتی که دوست داشتید راجع به این داستان فریز کردن اگ ها داشته باشید رو تا حالا گرفته باشید. برنامه رو میتونید به صورت آنلاین تو یوتیوب من و آوا تیوی تماشا بکنید. تا برنامه بعد، خدا نگهدار.